staying strong, healthy, and youthful. By subscribing, liking, and ringing, you can greatly support our channel and help us produce more content that you'll love. Hello and welcome to the Longevity Lifestyle YouTube channel. Tinnitus is a condition that affects millions of people worldwide. It is characterized by the perception of sound in the ears or head, in the absence of an external source. This sound can take many different forms, from a ringing or buzzing to a hissing or clicking noise. In this video, we'll be talking about the causes, symptoms, and treatments of tinnitus. What is tinnitus? Tinnitus is the perception of sound in the ears or head, in the absence of an external source. This sound can take many different forms, and it can be intermittent or constant. Some people describe it as a ringing or buzzing, while others hear a hissing, clicking, or roaring noise. Tinnitus can be caused by a variety of factors, including exposure to loud noise, age-related hearing loss, ear infections, and certain medications. It can also be a symptom of a more serious underlying condition, such as a tumor or aneurysm. Causes of tinnitus. Tinnitus can be caused by a variety of factors, including exposure to loud noise. Exposure to loud noise is one of the most common causes of tinnitus. This can include exposure to loud music, machinery, or firearms. The loud noise can damage the hair cells in the inner ear, which are responsible for transmitting sound to the brain. Once these hair cells are damaged, they cannot be repaired or replaced, which can lead to tinnitus. Age-related hearing loss. As we age, our hearing can begin to decline. This is known as age-related hearing loss, and it can be a common cause of tinnitus. As the hair cells in the inner ear begin to deteriorate, they can send false signals to the brain, which can be perceived as tinnitus. Ear infections. Ear infections can cause inflammation and damage to the ear, which can lead to tinnitus. This can be temporary or permanent, depending on the severity of the infection. Medications. Certain medications can cause tinnitus as a side effect. This can include antibiotics, antidepressants, and chemotherapy drugs. Underlying health conditions. Tinnitus can also be a symptom of a more serious underlying condition, such as a tumor or aneurysm. In these cases, it is important to seek medical attention as soon as possible. Symptoms of tinnitus. The symptoms of tinnitus can vary from person to person. Some people may experience a mild ringing or buzzing, while others may hear a loud hissing or roaring noise. The sound can be intermittent or constant, and it can be perceived in one or both ears. In addition to the perception of sound, tinnitus can also cause other symptoms, such as dizziness, fatigue, difficulty sleeping, irritability, depression. Diagnosis of tinnitus. If you are experiencing symptoms of tinnitus, it is important to seek medical attention. Your doctor will perform a physical exam and ask about your medical history and symptoms. They may also order a hearing test, which can help determine if there is any hearing loss or damage to the inner ear. In some cases, your doctor may also order imaging tests, such as an MRI or CT scan, to rule out any underlying health conditions. Treatment of tinnitus. While there is no cure for tinnitus, there are several treatments that can help manage the symptoms. Sound therapy. Sound therapy involves using external noise to help mask the sound of tinnitus. This can include white noise, nature sounds, or music. By providing a distraction, sound therapy can help reduce the perception of tinnitus. Medications. There are several medications that can be used to help manage the symptoms of tinnitus. These can include antidepressants, anti-anxiety drugs, and anticonvulsants. These medications can help reduce the perception of tinnitus and improve mood and sleep. Hearing aids. For people with tinnitus and hearing loss, hearing aids can be an effective treatment option. By amplifying external sounds, hearing aids can help mask the sound of tinnitus and improve overall hearing. Tinnitus retraining therapy, TRT. TRT is a type of therapy that aims to retrain the brain to ignore the sound of tinnitus. It involves a combination of sound therapy and counseling, and it can be an effective treatment option for people with severe tinnitus. Prevention of tinnitus. While it may not be possible to completely prevent tinnitus, there are several steps that you can take to reduce your risk. Protecting your ears from loud noise. Avoiding medications that can cause tinnitus. Managing stress and anxiety. Getting regular hearing tests. Conclusion. Tinnitus can be a frustrating and distressing condition, but there are several treatments available that can help manage the symptoms. If you are experiencing symptoms of tinnitus, it is important to seek medical attention to rule out any underlying health conditions and determine the best course of treatment. By taking steps to protect your hearing and manage stress and anxiety, you can also reduce your risk of developing tinnitus in the first place. With the right treatment and prevention strategies, it is possible to improve your quality of life and reduce the impact of tinnitus on your daily activities. Thank you for watching, and we hope this video has been informative and helpful. I recommend that you watch all the videos I upload from the beginning to gain a comprehensive understanding of the topics covered. Don't forget to like and subscribe to our channel for more videos on health and wellness. See you in the next one.